I am very concerned about the mental health and well-being of our pharmacists, our technicians, and our patients. Many times over during my career, I've had patients to come in and I would talk to them, but they later would come back to me and say that I was thinking about going home and committing suicide, but you took the time to talk to me. And just by talking to someone, I made that change. Every day, when you pick up the paper, you look at news media, it seems as if someone is committing suicide, and they talk about the numbers every day. I'm a Southern girl, born in South Arkansas, born and raised there, and I currently reside there. I went back home after I finished my pharmacy school training. I'm the mother of four, married to husband Carlton, and I love taking care of the people of South Arkansas. I've been a member of the Arkansas State Board of Pharmacy since 1991, a member of NABP, and I have served as a member, treasurer, president-elect, and now president. I also have been practicing pharmacy in South Arkansas for 43 years. Since 2020, pharmacists have been asked to do many things over and above what we normally have been doing over the past few years. And when COVID-19 came along, that caused a rapid change in what we do. We've had to deal with more pressures, more demands to take care of the public. There's been a big turnover in pharmacists. People are burning out. And when they burn out, they're quitting jobs, a lot of turnover in jobs. And we're also seeing, along with that, a decrease in the enrollment of students in pharmacy colleges and universities across the nation, and that exacerbates our problems with this situation. Currently, we have a shortage of pharmacists and pharmacy technicians, and it also affects our patients. That shortage can cause us to make mistakes, and those mistakes in our profession can lead to life-altering situations. And we as regulators with the pharmacy boards realize that that is too common a thing that could happen that could, really change outcomes with people. That also can affect the hours that the pharmacies are open. If we don't have enough staff, then the pharmacies can't be open, which creates other situations. Take, for instance, you need your insulin. You go to your pharmacy to pick it up and you find out that the door is closed. So you don't have enough time to go to another pharmacy to get it. So that leaves you with a night without your medication. And we as practitioners do not want to see anything like that happen. NABP is forming workshops to address these issues, task forces to look at these issues. And not only are we doing this with NABP, we're collaborating with other groups to come up with solutions to the issue of mental health and well-being. And I think that is great that other organizations in the world of pharmacy, medicine, nursing are seeing what I have been seeing, and we're taking the time to take care of our people. It's going to take collaboration between all of us. It's going to take us sitting down at a table, talking about these issues, coming up with solutions, and everybody will bring something to the table. It's something that you may know that I don't know, and vice versa. And when you get these things all together, we come up with good solutions. And with those solutions, we're going to put that on our website, and everybody can pull from it and share information. Burnout is real. It's happening all across the board in healthcare. It's happening with our pharmacists, our technicians, our medical doctors, and also our nurses. And what we've got to do, all of these groups have got to come together so that we can find solutions to burnout. For example, we can have our regulators, our employees, our employers, and also the pharmacy organizations come together to create concrete solutions to the challenges that we're having today. Some of the struggles are that we work hard every day, but we don't have enough people to do all the things that we need to do. And that put increased pressure on people. And sometimes people can take the stress, sometimes they can't. When I see a colleague in trouble, I would just ask them to go take a break. go walk around the store or just do something different for a few minutes so that you can change your focus. And that helps a lot, just to be able to break the monotony, even if it's for about 5 or 10 minutes. The best thing that I can ask you to do is practice self-care. And by self-care, I mean get out there, take those walks, get the exercise, eat the proper foods, get plenty of rest, drink plenty of fluids. We know these things. We tell them to our patients all the time, but do we practice them ourselves? And we just need to get around to practicing them ourselves. If you need some help, be sure to get in touch with a mental health professional. Sometimes it takes that just to get us back on the right track. And don't be afraid to talk to your colleagues about what's going on with you. Just talking to someone else can help a lot. I am one to take someone to the side and ask, are you okay? Just something simple, are you okay? May be the words that will break the ice so that someone will start talking to you. And again, you listen. And sometimes you will make a suggestion and hopefully they will take heed to the suggestions that you make. I guess most of all, I am an observer. I've done this all my life. It's one of the things that my grandfather taught me to do, is to notice what's going on around you. And one of the things that I've noticed is that my colleagues and also my patients are having undue stresses put on them, and it begins to affect them mentally. When something affects you mentally, it also affects your well-being. And I want everybody to be at a good point in their life, be at peace if they can. So I started asking people, what is the thing that you enjoy doing? And I just came up with a little term of, what is your reset button? And people, when they tell me about their reset button, the thing that makes them happy, it takes them to another place. It lightens their spirit. Over the years, I've got friends that do different things for their reset buttons. Some of them is hiking, some walking. My personal reset button is gardening. I like to do things like plant daffodils in the fall, and I get my happy returns in the spring. Right when it's dull, you'll look out and you'll see, the daffodils are blooming. I've got another friend, she likes to ride her Harley, and she will ride her Harley for hundreds of miles. I've got a friend that raises Black Angus cattle. Another friend scuba dives. We all got to have little things that we do that bring joy back to our life. You can lose that joy, but it's always easy to get it back, but you have to look for it.